Well, today on the show, we're over in Gulfport talking to Dr. Sonia Spencer, Sonia Spencer's chiropractic office. How are you?
I'm doing great, Jim.
Good to see you again. Now, there's a lot of things that people deal with as far as different aches and pains and things like that, and they think that maybe drugs will be they can just take some drugs and be a quick fix, but that's not always right. And today on the show, we're going to talk about a thing that a lot of people really suffer from is carpal tunnel syndrome.
Exactly right, Jim. And I'm going to explain to you some of the symptoms of carpal tunnel and some of the things that people go through when they have this syndrome and what can cause it and how we in chiropractic can treat it.
Now, what are some of the fields of work that you see most of this in? I'm thinking, carpal tunnel has to do with your arms and your hands. So I guess people who are on keyboards or working with computers and different things like that.
Right, that's exactly right. But anybody can develop carpal tunnel. Even a housewife can do it. And the reason why is because there are so many things that can cause carpal tunnel. It's one of the most misunderstood problems that we have in our society today. But what happens is that a person can develop pain in their hands, mainly in these three fingers right here. And that is truly a carpal tunnel syndrome when they have pain in these three fingers. The way that this is diagnosed is through a series of tests that we can do in our office. And one of the reasons why surgery is not really successful for this type of problem is that is just treating the problem at the wrist. One of the things I'm going to show you on this little diagram is that this is a very long nerve, and this nerve actually begins in the neck and goes all the way down the arm into...
So that's that long yellow line there.
Yes, it's this long yellow nerve here, and it can get pressed on at many different areas. One of the main areas that it starts out is actually up here in your neck. Okay, so as part of treatment for this, we're going to start by checking your neck and making sure that you have good range of motion in your neck. Okay,
wow.
One of the reasons why carpal tunnel surgery is not as effective as they had hoped for is because that's just checking it down here. Okay,
when it really starts up here.
When it can really start up here. So in chiropractic, what we do is we check the nerve all the way down, beginning at the top, checking the nerve around this elbow here, checking the nerve at the wrist, checking the nerve at the shoulder, checking the nerve all the way down. Some of the symptoms that you can get here is patients say, I have problems gripping, I have problems using my hand, I wake up with my hands numb at night.
Wow.
I'm losing the strength in my hands. And, patients that are treated properly and have the proper diagnosis with this particular ailment get great results in chiropractic if we're treating the problem correctly. If the problem is not treated correctly and they just have, a surgery here to loosen up that little flexor
ligament thing, yeah.
Then that's just treating part of the problem. Say, for example, that patient is a person that has been a cook all of their life,
right?
And has worked in restaurants or something, and they've been over and they're cooking and they're doing different things, and they develop what we call that forward head posture, where they're bent forward. Well, for every inch your head goes forward, these muscles in your shoulders have to work 10 times harder.
Wow.
And what happens is that will actually begin to squeeze these nerves as they come out and go down into the arms. Then the person can actually develop what's called double crush syndrome, which is a pressure on the nerve in two different places. Out into the shoulder out here.
Out in here? Okay.
And down into the wrist.
So all the way down into here.
Yes, absolutely.
Wow.
So many times, a person will have no neck symptoms whatsoever. But when we measure their range of motion, they will have, maybe 50% of the motion in the neck that they should normally have.
So proper posture when you're seeing it, whatever you're doing, is very important.
It is very important, but it's hard to do in your work environment.
I have to say, this, we have a young lady that works with us up in our marketing department that we always pick at her. But when she sits, even though she's at the computer all day, she has the most perfect posture. And that's something that, like you said, it's very, very important. You might not do it all the time, but you might try to start thinking about doing it unless you want some of these long-range problems.
Absolutely. And, when a person has to have an improper posture at work, say they're bent down all day looking at something like a cook, or somebody who has a repetitive motion posture at work, like a checkout clerk,
Right.
constantly using one arm all day, or a hairdresser, where they're using that one arm to blow out that hair all day, or
Wow.
whatever they do. It's important to have some type of exercise that is stretching out the proper muscles so that you don't develop problems within your spine. We actually have in our office a test that we can do called a functional assessment test, and it'll let you know if your body is developing problems that could develop into something like this. And we actually would compare your range of motion to people in your age group to see if you're aging prematurely, and see if you have the proper posture that could be causing premature aging in your spine. See if it's causing abnormal wear and tear on your spine that could be contributing to this carpal tunnel syndrome or other symptoms down into your arm and hand.
Wow.
Carpal tunnel syndrome is often misdiagnosed. I want to read to you a quote from Dr. Susan McKinnon, professor of surgery at Washington University School of Medicine in St. Louis. She said the high failure rate of surgery has caused her to rethink the cause of carpal tunnel syndrome.
Wow.
So, if the professor of surgery can say, wow, I'm going to rethink the cause of this, we've got to be looking at other causes. And chiropractic is a great place to start if you're having any symptoms related to your arm, hands, or so forth.
That is great information. So if you think that you might be having a problem, with your hands or whatever, it could be carpal tunnel. Call and make an appointment with Dr. Sonia Spencer here on Pash Road in Gulfport, right across from Pash Road Elementary. And thank you so much again
You're
for some
welcome.
great information on that. And we'll have more things down the road for you, some great information from Dr. Sonia Spencer here at Spencer Chiropractic, located on Pash Road in Gulfport near Hardy Court. One problem that a lot of women deal with when they reach their 30s is fibromyalgia. And Dr. Sonia Spencer with Spencer Chiropractic, how are you?
I'm doing great,
It's good
Jim.
to see you again.
It's great to see you.
And that's true. I mean, I know men get it, but it's true that it's more so women.
It is mostly women that get fibromyalgia, and it is a very serious problem in our society today. Fibromyalgia is a chronic pain syndrome that women deal with, every single day. And a lot of women take medication daily to deal with this issue.
What causes it?
Well, it's a problem that has no unknown cause, that has an unknown cause.
Right.
They haven't been able to say, this is the cause of fibromyalgia. So they can't just say, well, it's a virus, it's an accident, it's a psychological issue.
It's hereditary.
It's hereditary. None of those factors have been determined. And so it takes literally a village to treat fibromyalgia.
Wow.
A person has to really determine the best course of treatment for themselves. But I'm going to explain to you how chiropractic can help fibromyalgia today and how we can treat someone with fibromyalgia.
What are some of the things that may give you a telltale sign that, okay, I think I may have it?
Okay, well, fibromyalgia is diagnosed by trigger points along the spine, and that's basically, you can diagnose yourself by taking a self-test on the internet.
I think you can test everything on the internet now.
Yeah, so everybody, and unfortunately that's how a lot of diseases are nowadays. You can take the self-test, and so with the development of these trigger points actually correlate to a lot of the trigger points that we can help in chiropractic care. And that's why I want to tell you there is hope if you have trigger points along your body with getting chiropractic care. And I want to show you some of the things that can cause trigger points and tell you what a trigger point is.
Okay.
And explain to you some of the things and what fibro is like a fibrous tissue, and myalgia literally just mean muscle pain. Okay. And so in looking at this little model here, this is an example of a joint, and to the left and to the right here, we are looking at muscles. And this represents a trigger point in the muscle belly. You see how nice and big and swollen this is?
Yeah, yeah.
And this over here,
Looks
you see,
dead.
Yeah. Well, you see how it's kind of all crossed up there? That's where the body has attempted to heal a muscle in a way that has not really been conducive for the body. And on this side, it's representing some scar tissue. So it looks like that this side of the body has been damaged, and this side is inflamed. Okay? So when we are examining the spine, we can actually feel these trigger points over here. And there have actually been studies that the type of therapy we do here in our office, one of the therapies we do called the cold laser therapy, when we do the cold laser therapy over these trigger points, that they lessen and they're relieved with this type of treatment. That's one of the studies that you can find from the National Institutes of Health, which has studied fibromyalgia, that these are relieved with the cold laser therapy that we do right here in our office.
I remember in some of the past segments that we've done here that you've demonstrated the cold laser therapy, and this is like it's just being touched with a little cold wand.
Absolutely, and it's a totally non-invasive therapy that has no negative side effects, and it gets great results for these types of trigger points. So let's explain what it causes some of these trigger points. Now you notice that there's little nerves that are connected here. These little yellow things are nerves, and it's connected to a joint. Now if a joint doesn't move properly over time, it's going to start firing pain signals into this muscle and give a feedback into this joint. In fibromyalgia, I have found from being a chiropractor for the last 13 years that what happens many times in these fibromyalgia patients is that these joints are really locked up and not moving properly. And in fact, they should have a normal motion that they don't have, and they're not moving properly. Now, one thing about fibromyalgia patients is it really hurts them to get a lot of movement. And perhaps sometime in their lifetime that they can remember or either not remember, this part of their spine was damaged. And so we have to very, very gently get some movement in this area. And they're not going to respond well to the typical chiropractic adjustments. So we have to use very, very, very gentle chiropractic adjustments with an instrument, the lightest instrument we have on these areas to get some movement back into this. And once that happens, the joint will begin to move well. And as we do the cold laser on these trigger points, the body will begin to resorb some of these pain signals that are going into this area. And the result will be a better quality of life for this patient. Will fibromyalgia 100% resolve? No.
That was my next question. Is there a cure for it?
There's no cure.
There is relief.
There is relief, and there's better quality of life.
That's the important thing.
As we talked about on earlier segments, if you leave a joint like this, what happens is it deteriorates and the problem can get worse. And medications, a lot of times just treat the symptom without directing any problem to any kind of cause of it and allow a joint to deteriorate. And so in many years later on in life, the patient will actually get worse and then end up on more medications with more serious problems than they realize.
And the medications, they're just masking the issue.
It is just masking the issue, which we understand that patients do need medication, but they also need to address the cause. So this is how chiropractic is different. We address cause, and medications many times just address symptoms. And sometimes both things need to happen simultaneously.
Wow.
So in chiropractic, if we look at the whole person, we need to look at fibromyalgia patients nutritionally. We need to look at, are they in healthy environments, the thoughts you think, the foods you eat, what type of exercise are you getting, all of those things. Water you're drinking. Many people are eating unhealthy diets, consuming foods that are inflammatory. We need to address all that with a fibromyalgia patient.
So put down that double cheeseburger. Thank you, Dr. Spencer.
You're welcome.
If you want some more information about this and like to make an appointment, the number is on your screen. They're located on Pass Road in Gulfport, across from Pass Road Elementary, Spencer Chiropractic. There's one thing that probably just about every person on earth suffers from at some time or the other, and that's a headache. And you can't blame it on your mother-in-law at all. Dr. Sonia Spencer, how are you?
I'm doing great, Jim.
Well, thank you very much. And headaches could be, if people think, okay, I've got a sinus headache. I'm just stressed out, I've got a headache. But headaches can be caused by, things that you wouldn't think of.
That's exactly right. And many people think that headaches are quote unquote normal. I just get normal headaches. I hear that all the time in a consultation with patients. In fact, they don't even write down on their case history that they have headaches. But when I talk to them, they're having like 6 or 8 headaches a month. And they think, oh, that's normal. I'm just getting a normal amount of headaches. But it's not normal to have headaches and have to take a leave and ibuprofen and Tylenol for headaches. If you're having 6 or 8 headaches a month, you need to look at something and see what's causing those headaches. And there are many causes to headaches. And we're going to talk about the number one thing that I find in my office that causes headaches, and that's misalignments in the upper neck.
Really?
Yes. You have some delicate nerves that come out in your head and go up into these areas.
So this is the nerves here that you're talking about?
Absolutely. These nerves control everything, basically the blood flow, everything that goes on in your head up here. And these nerves can trigger migraines as well. So let me explain to you a little bit about how this happens on this model. On this particular model here, these are 1-2 bones and a big old nerve in the center right here.
Right.
Now sometimes the vertebra can twist and misalign and cause pressure on the nerves.
Right.
And these nerves can come out and go up into the sides right here and interfere with the normal blood flow into your brain. And your body will not allow anything to disrupt the blood flow into your brain. So it's going to regulate that blood flow at all cost. And so having normal blood flow into your brain is just very important. So the body is going to do something to regulate this blood flow and recreate normal blood flow. And oftentimes that can trigger a headache or a migraine. And so in chiropractic, what we do is we restore this normal alignment back into here so that the blood flow, the nerve flow can be regulated, and thus this nerve controls that blood vessel. And the blood vessel can be normalized again. Now you might think, how does this happen? How does this work? How do I get misalignments in my neck? Okay, many times this can begin in childhood. All right, just think about this. This is an example of the skull right here.
Right.
These are the top 2 bones in the neck. This little red area here represents the blood vessel that we're talking about, Jim.
Right.
And this is how it would go up into the brain. You think about the baby coming through the birth canal and trying to get out this way. So many times the head will get twisted coming through the birth canal. And because the body is so adaptable, you know, it's going to do everything it can to try to realign the spine, and our bodies were made to heal. But many times, you know, it'll leave the vertebra somewhat twisted, and that will remain that way for a number of years. And when the body can't adapt anymore, you'll start to get some symptoms. And those symptoms many times will be headaches. One of these bones will stay twisted here. And over time, that's going to affect the nerves and the blood that go up into the head. Now in chiropractic, what we do is we gently realign these bones that go up into the head and the neck, and allow this nerve flow and blood flow to regulate, and this will alleviate the headaches. Another cause of chronic headaches is when, and this is a real common cause right now, is forward head posture. When someone who, this is a normal alignment of the neck and head, where, like on this model right here, the head is over the shoulders.
Right.
Well, right now with everybody texting and doing everything they do, I see people coming in, their head is 3 and 4 inches in front of their shoulders. Well, what this does is it allows the nerves right here to get squeezed, and it gets so tight that it will squeeze those muscles and allow those nerves to be pinched going up into the head. Now those can trigger headaches as well. So what we do is we look at all the posture in the spine, the alignment of all these vertebrae here, and make sure that everything is clear, the posture is correct. And many times, you know what patients say to me?
What?
How come anybody didn't tell me that chiropractic could help my headaches, and I've been on all this medication for all these number of years, and nobody told me to go to a chiropractor?
Wow.
You know what I tell them? We're the only people